Greetings from Health and Beyond. I'm Dr. Shanta Mishra, a health communications and wellness expert, and your host for today's session. In recent times and post the COVID pandemic, public health has generated renewed interest and focus across the globe and in India. India's public health needs are evolving mainly due to demographic shifts, lifestyle changes, and emerging health challenges. They include aging, population, urbanization, lifestyle diseases, new infections, drug resistance, pollution, and climate change. So too is the case with public health education in India that has evolved to address the country's dynamic healthcare challenges. But there's still room for improvement. To discuss this further, we have today Dr. Anil Purohit, the founder of the Jodhpur School of Public Health. Dr. Anil is a global public health specialist with over 25 years of experience in Asia and Pacific, Africa, Europe, Latin America, and the US. He has studied at the Northeastern University, Harvard University, and the Medical College of Ohio. His former affiliations include being a US government public health officer, Global AIDS Director at Harvard Institute of Medicine, Country Director India for the University of Washington, CEO of FXB, among other positions held. He is also working currently as the Global Director and Board Member of Bedford Stem Cell. During this course of time, he has established HIV clinics, counseling centers, clinical labs, and training centers globally. Recognizing the need for a strong public health education environment in India, he has established several public health training programs and schools of public health in India. He is living with a cadaveric donor kidney for over 7 years and realizing its importance is also active in organ donation awareness activities and campaigns worldwide. Namaskar. Welcome, Dr. Purohit.
Thank you. Thank you so much.
So our first question today would be, how has India's public health system evolved to address the changing needs and challenges?
Personally, whatever I learned in public health all begins in India, though I was trained and educated in Boston, but all my public health experience goes and thanks to India. Since independence, 1947, India has come very far, actually. And talking about AI, digital health, the largest HIV/AIDS national program, India did a wonderful job, actually. And National Health Mission, we talk about digital health, like in geriatrics, sensors. This is all public health, actually. And India has just done wonderful. Only thing India has not is that never defined public health, but India always did wonderful work on public health. And I think it's turning out to be a global health leader, basically.
Thank you for the kind words. Public health training requires an interdisciplinary approach, as in many topics today that we take up. It's not just singularly one stakeholder anymore. So to address all these newer challenges that we have talked about, like climate change and lifestyle diseases and changing demographics. So what are your views on involving many other non-health stakeholders in public health programs?
I think there is a big need, and India is already involving. In my experience, when I ran FXB programs in India, we had people from all walks of life, whether they were lawyers, whether they were accountants. You need them for health financing. You need attorneys for health and human rights, ethical issues, institutional review boards. So I think it's very interdisciplinary, and without that, you cannot succeed. I'll give you a very good example. Coming to the current age we live in, the AI, the digital health. There are programs at Harvard University School of Public Health where they teach high school students Python and AI and driverless cars, actually. Now, the question comes, why driverless cars, actually? Why in public health? But in 50s and 40s, there used to be lots of accidents in the United States. So they brought CDC together with the engineers, public health engineers, and they all discussed, how do we solve this? Now, to do that, to avoid accidents, we need better roads, actually. Simple thing, again, if you see a diabetic patient, you tell them, go for a 2-mile walk, 2-kilometer walk. But if the roads are not better, how would you do that? So you need engineers.
Of course.
So I think interdisciplinary is such an important subject, and we need everybody together. And one of the important initiatives we have is on climate health, which we partnered with Manipal University in Jaipur. So we are teaching civil engineers public health and climate health. So we bring leaders from civil engineering, from architecture, from allergy and infectious disease specialists, and public health professionals. And as Dr. Shanta Mishra asked me about interdisciplinary, I think this is a very good example of interdisciplinary teaching, where you bring everybody in one room and teach them what to expect.
This is the first time we are talking about engineers and doctors working together.
Yes.
Scientists working together.
Exactly.
It's almost like the One Health program we talk about.
So One Health also is very, very important. I think during COVID, we learned a lot, actually, why One Health is important. We always knew. But also at the same time, what the world is missing, which I learned at IIT Bombay with our partner, our collaborator, Dr. Sarthak Gaurav. He wants to work on wild animals, actually. And why do we exclude them, actually, from the forest, the wild animals? So One Health is very, very important. So during HIV, we learned a lot about SIV. So One Health is very, very important. We cannot ignore that together. And India is getting there. I think there was a time when they always thought the doctors can only run the medical and health field, but that's no more, basically.
So you feel that the education as well should include subjects like economics, and the medical education should include economics and engineering and design. I mean, people should be aware, doctors should be aware now, aware of these.
Absolutely, I think absolutely. My undergraduate at Northeastern University, I studied medical ethics, philosophy, biomedical engineering. In fact, in 90s, we had a book on AI, actually. This was all theory, actually. So I think that's very, very important. And I think it should be an overall, actually, teaching to everybody, I think. And I was reading yesterday in United Arab Emirates, every school will be teaching AI, actually. So I think undergraduate education, high school, should be all interdisciplinary, basically.
So public health is, again, largely government-driven and implemented. And so how do you think that NGOs or non-government and private sectors can contribute to address the knowledge and training gaps in public health?
I don't want to be political right or wrong, but currently, as we see, US is pulling away from the global health, actually. And I don't know if it's right or wrong, and I don't want to say anything. But I think it's also giving a great opportunity at the same time for countries and for regions to be more regionalized or localized, actually, to become global leaders, I would say. For example, public-private partnerships, World Economic Forum talks all the time, and I've been involved since 2000. So I think public-private partnership is something very, very important. India does wonderful work on CSR, corporate social responsibility. I think this is where it should begin, and I think all the non-governmental could really play a major, major role, actually. And one important thing I feel is we see at United Nations, we say in the government, private donors do come, they do contribute, and I think it's been a great service what they do to the world. So I think involvement is very simple and easy, like the Rotary clubs, the Lions Club, definitely, and all of them have doctors or clinicians or public health professionals and nutritionists. So I think they can play a major role. You cannot be totally dependent on the government, but government has to set up the policies and guidelines. Otherwise, things will be like all over. So definitely, let's not depend on the government, any individual government, I think.
Any innovations or digital technologies which you have already talked about earlier that you think can be an out-of-box strategy to deal with our public health challenges?
Absolutely. Currently, I'm working with Swarna IU in Bangalore, startup, and where JSPH has partnered in Jury Technologies, where I'm an advisor. We have joined hands. So let's say at home you have elderly parents or grandparents. You go to work, they're left alone. You know, around between 9 and 10, they will go to the bathroom, and you have sensor which you could monitor actually. But if you check and if they haven't gone, or if someone has fallen, you at least get the message. So geriatric is progressing a lot, and I think there is a big need. And we have realized during COVID times when children or kids were away, parents were left alone actually. A big need came up for a digital transformation. And we at the
Monitor.
Jodhpur School of monitoring, and at the Jodhpur School of Public Health, we ran at least 5 or 6 workshops on digital transformation of public health. So definitely we have come very far, and AI innovations, digital health is the key now, I guess, in the changing world.
A little known fact is that Dr. Purohit has also made a movie. So we would like to you to talk about it a little bit
Mhm.
at the end.
Yeah, sure, absolutely. So I had pitched a documentary on traveling the impossible road, talking about my personal life and how inspiring it could be for the young generation and everybody living with the terminal illness or chronic disease. I live with terminal illness, kidney failure. I do have a transplant, which is very successful, but transplant is not, I would say, a cure. It's a treatment. And I was on dialysis for 4 years. In the family, we have PKD, which is polycystic kidney disease, autosomal dominant. Both my sisters on the West Coast in the United States have it. My mother had, my uncle, my mama, he had, my cousin in Texas had. So we live with that dialysis over dialysis. And I did not give up. I did not give up my work. I traveled around the world, arranged my dialysis, did my work as usual. And the important part is that I think physically you have to be fit, correct, but mental fitness is more important, basically. And so I think the movie is mostly based on that. And then I have some patients from HIV, um, living with HIV, I would rather say, have been giving testimonials and how they're surviving for the last 20 plus years. So life is very interesting. I think it's all the mental fitness. Make it a lifestyle, actually, whatever you have, and learn to live with it. Because when people tell me that, oh, I'm so tired, in Hindi से हम दुखी हैं, परेशान हैं, I tell them, तुम्हें पता भी नहीं है दुख क्या होता है. And they ask me what. I said, when I work in remote areas of Asia or Africa or Central Africa, and when a pregnant woman dies not of hunger, of thirst, that's pain. That's dukh, actually. So people don't even know that, actually. I think you have to adapt it, learn to live with it, and life is beautiful, actually. You just cannot have a simple kidney kind of, stop your life. So that's what the film is about, and I would like everybody to watch. It's not for my publicity, but it's an inspiration that we all can live happily, and it's a beautiful world, actually. Thank you.
Any other message, final message you have for our viewers? Anything you would like to say for our viewers? You've already said a lot of
Uh,
very inspiring messages you've already given, but any other final message?
no, your infectious smile makes it more inspiring. um, Definitely, I think invest in public health. Public health begins at home, and I think that's very important. Um, the returns are great. You don't make much money on that, but human life is all about it. Happiness comes when you live happily, when you're happy. Money is secondary. Innovation is great, but innovations make you happy. But if you're happy, you'll do better innovations. So I think the message to the public is that take care of your health, be fit, be mentally fit, And Dr. Mishra is an expert on mental health, so she could guide us more. But I think that's very, very important. So that's only my message: invest in public health.
Very, very nice. Thank you for an elaborate discussion on public health education in India and elsewhere. I'm sure our viewers are well aware of the evolving needs and priorities in public health. This was also good to hear about your film, which is very inspiring. Thank you. Thank you, Dr. Purohit.
Thank you.